Tonight, we begin with a story that is raising alarm across the country of botched circumcisions that has left one boy dead and 18 boys admitted in different hospitals with complications. At the Moi Teaching and Referral Hospital in Eldoret, Uasin Gishu County, 16 victims of botched circumcisions have been admitted in the last 1 month, with one of the boys recuperating in the intensive care unit. In Bungoma County, a family is grappling with where to get the funds to take their 11-year-old son for specialized skin grafting out of the country 2 months after the boy was circumcised at Bungoma Referral Hospital. This comes even as the Kenya Medical Practitioners and Dentists Council launches investigations into the cases. This story was produced by Gatete Njoroge.
Ndengelewa village in Kandui, Bungoma County. For close to 2 months, this 11-year-old boy's life has changed for the worse. Forced to walk around covered in this lasso, unable to put on what he normally would, shorts or trousers. His initiation, which would have been celebrated, has turned into a nightmare for himself and his family after a botched circumcision procedure at the Bungoma Referral Hospital on November 28th last year.
Tarehe 13 mwezi wa 12 ilikuwa hawa watoto wao wamepona, tupange vile wanaweza toka jandoni. Kisha nikaona mtoto kutembea kwake, anatembea kwa uchungu, wakati analala kula anakolala, wakati mwingine unasikia kuna harufu. Aliyefanya circumcision ni kama hakufanya vizuri, alitoa ngozi yote, kisha akagundua ya kwamba kulikuwa na makosa, akaregesha, alafu akashona upande wa mbele. Sasa huku nyuma kulikuwa kunazidi kuoza na ngozi ya juu nayo ikafanya nini, ikawa inakufa.
The family would later take him to a private hospital within Bungoma County, where they did another operation to try and correct the complications.
Daktari alipoangalia tu mtoto akasema hii tayari imefanya nini, hii imekufa. Mimi nikashikwa na wasiwasi nilipoambiwa kwamba hii kitu imekufa. Kufa inamaanisha nini? Sasa nikasema sasa ni vipi tunaweza kusaidia mtoto? Akasema tutakuitia daktari mwingine pia anafanya kwa wilaya, hospitali ya wilaya. Baada ya kama malisali moja aliweza kufika na akasema hii jinsi ilivyo lazima arudi aweze kuingia theater.
For 2 weeks, the boy was admitted at the facility before being discharged on December 28th last year. The family, which now has to visit the facility every 2 days, says the situation has drained their savings as they have so far spent over 150,000 shillings.
Tunaambiwa kama ni labda specialized attention, huenda labda afanye nini, atatolewe nje ya nchi, hatujui nayo itatugharimu pesa ngapi na hatuna pesa. Hatua ichukuliwe dhidi yake, alafu afanye nini, aweze kujukumika.
About 100 kilometers from their home at the Moi Teaching and Referral Hospital, 16 other boys are also recovering from circumcision complications. According to the hospital chief executive officer, Dr. Wilson Arwasa, 16 boys who had secondary complications of infections were admitted at the facility. One of the boys was admitted to the intensive care unit, while the rest are being treated and discharged depending on how they respond to treatment. Dr. Arwasa says this year has witnessed an influx in the number of circumcised boys seeking treatment after the cut. The facility is now working with Uasin Gishu, Nandi, Elgeyo Marakwet and Baringo Counties public health departments to ensure that circumcision surgeons and communities put in place proper infection prevention and control measures. The family of the late 14-year-old boy Ibrahim Kirwa Minor is still mourning after the untimely death of their kin, who died as a result of a botched circumcision exercise in Nandi County. The late Kirwa, who was buried on December 30th last year in Uasin Gishu, scored 395 marks in KCPE. Meanwhile, police in Rongai, Kajiado County are still looking for a doctor who is accused of carrying out a circumcision procedure on a 13-year-old boy and left him with life-threatening injuries. The boy is now recuperating at the Kenyatta National Hospital, awaiting full recovery before a reconstructive surgery is performed, even as the clinic where the doctor operated from remains closed. The Kenya Medical Practitioners and Dentists Council has launched a probe to determine whether the medical facility is licensed to operate.